primary action usually that the TFL is considered to do is hip flexion and internal rotation. Because when we're doing muscle testing for the TFL, you're doing it like this. Okay? If this person's laying down, you're internally rotating, and then you're resisting in this direction here. Okay, and then also it can do abduction of the thigh here. Okay, since it's on the side here. But mostly it's going to be considered to work as a synergist of the psoas. And it's going to do medial rotation of the thigh. Yeah, medial rotation of the thigh. And then since it's one of the things that the TFL does is it stabilizes the lateral side of the knee. So that's one of the actions that the TFL does. A lot of times people have iliotibial band syndrome and problems where what happens is that band, as somebody's running, it'll snap across the bone right here. Usually at the lateral side of the distal tibia, femur. So the iliotibial band can snap across that bone. And it'll happen more likely if somebody's changing their running terrain, maybe if they're running on hills, or going up and down, or running sideways, like if they're running along the side of the hill like this. So that's iliotibial band, and the tensor fasciae lata is important for lateral stabilization of the knee. All right, so then now we have the sartorius muscle. Okay, and that's considered a tailored muscle. Originally, when tailors were working, they would be sitting cross-legged like this. So the actual action of the muscle is going to be to pull up like this. So it's going to flex at the hip. It's going to externally rotate, and then also flex the knee. So the origin is going to be the ASIS. It's going to come up from up here again. And then it kind of spirals down, and then it's going to go across onto the tibia. What's that? ASIS, anterior superior iliac spine. Remember we said we have 4 of them? You have the ASIS, AIIS, PSIS, PIIS. And then the insertion of it is a specific area. It's called the pes inserine, which means goose foot. Okay. And it's going to be right on this part here. Okay, so the proximal medial tibia. And then there's 3 muscles that are going to insert onto that. And we're using the mnemonic SGT, which is the abbreviation for sergeant. Okay. So it's going to be the sartorius, the gracilis, and semitendinosus. So all those muscles are going to insert right in this area here. Right. And then you can also sometimes get bursitis in that area because there's a bursa over that pes inserine. So you have pes inserine bursitis, and you have iliotibial band bursitis. And then again, we mentioned the rectus femoris is part of the quadriceps, and that's the one part of the quadriceps that goes across 2 joints. So the rectus femoris crosses the hip, the rest of the quadriceps does not. So the rectus femoris is going to come off of the AIIS, which is the anterior inferior iliac spine, going down across the knee, down the hip. And then all the quadriceps are going to insert to the tibial tuberosity by way of the patella and the patellar tendon. So you don't really, even though it's attaching to the bone here, which is the patella, you're not considering that insertion because, like I said, the patella is pretty much part of the actual patellar quadriceps tendon. So the insertion is actually here, the tibial tuberosity. Okay, and then we'll talk more about the tibia. But the tibial tuberosity is basically this bump you can feel on the front of your knee right below the kneecap. So then the rectus femoris again is going to have action at both the hip and the knee. So it's going to be a weak hip flexor, and then it's also going to be a knee extender. Then the rest of the quadriceps, you're going to have the vastus lateralis, the vastus medialis, and the vastus intermedius. So medialis is going to be obviously on the medial side, lateralis is going to be on the lateral side, and then the other one's going to be in the middle. Okay, so for the vastus lateralis, it's going to start at the greater trochanter here, and then you also have this intertrochanteric line, which goes between the two trochanters. That's going to come across like that, and then it's going to insert onto the tibia. Okay. Then medialis is going to come wrapping around from the backside. Remember, you have the vastus intermedius is going to be attached onto the bone here. So there's no, it's all covered up. So the only place left for the vastus medialis is to come from back behind here on this linea aspera, which is a little bit more to the back side of the femur. So it's going to come around like this and then insert into the, again, to the tibia tuberosity. And there's some stuff in here I put about the VMO. Okay, has anybody heard of that before? It's a specific part of the vastus medialis. It's usually considered this part down here, the more distal part. Okay, like if you extend your knee, the kind of part of the knee muscle that bulges out here, right here. Okay, so this whole thing is vastus medialis. Hold apart here. Okay, so this is vastus medialis, and then VMO or vastus medialis oblique is down here. So a lot of times when you're talking about knee exercises and rehab and stuff, you're talking about doing terminal extension to work the vastus medialis oblique. Okay, terminal extension is the last part of extension. So a lot of times you're doing exercises like this, where you just do the last part of knee extension. And then, if you read the part in the notes, some people are saying, well, that maybe there really isn't such a thing as vastus medialis obliquus, and kind of a little bit of controversy. Because the idea is that what happens is the patella, a lot of times you have condylation patella problems, the patella tends to move laterally. And so the idea is to try to work this vastus medialis oblique to stabilize the patella and pull it more medially.
That causes medial lateral knee pain.
What's that?
Is it medial lateral knee pain with that VMO is?
It's usually center. The problem is usually condylation patella, which is patellofemoral dysfunction, which is pain at the knee that's more superficial.
Okay.
Okay? The people that have problems, because it's a cartilage joint between the patella and the femur, right? So you can have arthritis, basically. You can have wear and tear on the cartilage. And then the time that those people are going to have knee problems is going up and down stairs, particularly going downstairs. Right? And then there's another thing that's called, you have a problem if you're sitting for a long time and you go to get up, that will be pain in the knee. And then pain with this type of thing is going to be more superficial, right? Because obviously that cartilage surface is more superficial to the knee versus deeper in the knee is where you have the meniscus and things like that, which we'll be talking about later. So there's something called a movie sign. Okay? So that's when you're sitting through a movie and you go to get up and your knee hurts. That's probably back more from the days when they had double features, right? When you sit through two movies, a little bit longer. So then you have the vastus intermedius. Okay, so then that's going to come off of this surface here of the distal part of the femur. And then that's going to go again into the tibial tuberosity. So all those muscles together, there's four of them, right? So that's why they call it quadriceps. So that's going to do knee extension. Except which one of the quadriceps acts at one of the other joints? Which one crosses the hip? Right, smart.